You've probably heard about this new study by the Surgeon General about the impacts of isolation and loneliness on people's health and on America writ large. Greg Olson is with the New York State Office for the Aging, and he says it affects all age groups.
Social isolation increases the risk of premature death. It increases your risk of dementia. It increases your risk of depression, anxiety, and suicide. It's the equivalent of smoking almost a pack of cigarettes a day.
How older adults in the North Country can avoid those issues and stay engaged with friends, family, and community on today's story of the day.
Support for Story of the Day comes from Long Run Wealth, an SEC-registered investment advisor in Lake Placid, providing comprehensive wealth management, retirement, and financial planning solutions. LongRunWealth.com. And from SciTech Business Solutions, training and consulting services to help businesses grow. More information at citec.org.
Hey, I'm David Sommerstein. It's Wednesday, May 17th. First up, the last major hospital system in the North Country to require masks is ending that mandate. St. Lawrence Health, with hospitals in Potsdam, Massena, and Gouverneur, and clinics across St. Lawrence County, called the change, quote, a major milestone with the reduced presence of COVID-19 in the area. Hospitals in Watertown, Plattsburgh, Saranac Lake, Alexandria Bay, Glens Falls, and Malone had all switched to a mask-optional policy in most facilities. Officials in Canton are proposing to rebuild the Town and Village Municipal Building, but the planned $25 million project is still in the early stages. NCPR intern Maya Mackey has more.
Canton's municipal building sits on Main Street in the heart of the historic downtown. It was built in the 1960s. Michael Dalton, the mayor of Canton, says the building is unsafe and inaccessible.
Well, there's problems with our plumbing and heating, air conditioning. There's water coming across the floor in the basement. We have issues with handicapped accessibility. You cannot get up into the police station right now if you're handicapped or disabled in any way.
Officials hired architects from Watertown and asked employees what they wanted in the new building before announcing the proposal to the town and village boards. The new building will have more room for the Canton Police Department, storage for historical items, and a larger and more accessible parking lot. Dalton is working with Canton Town Supervisor Marianne Ashley on the proposal. Ashley explained that they bought the McDonald's property next door, and they plan to start construction there.
We just closed on the McDonald's property, and the idea is to build on that space along with the parking lot, and then transfer, and then demolish this building. So we've outlived our space.
Dalton and Ashley agree that their primary concern is for the health and safety of everyone who uses the Canton Municipal Building.
Well, this is two hubs of government, the town and village. The employees that work here, 30 people, they deserve better working environments.
The town board and members of the village will need to approve the proposal, and they need to start fundraising. But right now, that's a long way off. Maya Mackey, North Country Public Radio.
Greg Olson, the acting head of the State Office for the Aging, says his agency has launched a lot of initiatives to tackle the issue of isolation and loneliness among older adults. Things like a robotic pet project. Yes, there is such a thing. Yes, there is such a thing. Subsidizing online classes for older adults, and a pilot rideshare program currently running in 3 counties. Olson told Champlain Valley reporter Kara Chapman that some things that help with social isolation don't cost anything at all.
Checking in on a neighbor. If you have an older adult in your life, make a phone call, stop and visit once in a while. You know, the senior centers are back open now, so people can actually get out to places where they can interact with others, because we know when you are not isolated and you're interacting, your brain function increases, your physical strength increases, your purpose in life increases, and your overall attitude increases. And, you know, I don't think we put enough emphasis on purpose and attitude. When you look at people that are living past 100 years old, the main thing that researchers are finding is a positive outlook on life versus somebody who might have a negative outlook on life and what the impact of that is.
You know, your agency and its network covers the entire state, but what are the main challenges with regard to aging that you hear about in rural areas like the North Country?
Actually, the challenges are very similar, surprisingly. Affordable enabling housing, transportation, getting community services that help support older adults to stay independent and out of hospitals, emergency departments, and nursing homes. So I think that the overwhelming challenge for aging is that most older adults, if not all of them, prefer to stay in their home and communities. It's much cheaper to do that. They will succeed and have better health care and quality of life outcomes. But we have a health and long-term care system that's very reactive. So we spend a lot of money on the back end, and we don't put the prevention and community-based services into the community to prevent those high-cost settings.
I did want to touch on last fall when Governor Kathy Hochul signed an executive order to create the state's master plan on aging. Can you talk about, why is that needed?
We started this work in 2005, trying to create livable communities for people of all ages. That morphed into becoming the first age-friendly state in 2018. The master plan for aging is really age-friendly 2.0 on steroids. What it does is allows us to really connect the dots at the state level, work with county governments and other public and private organizations at the community level and the population itself, because 60% of all healthcare costs have nothing to do with a healthcare diagnosis. 10% is a diagnosis, 30% is genetic, 60% is your environment. What are my personal things that I do? Do I smoke? Do I eat well? Do I exercise? What does my built environment look like? My water quality, my air quality, lead paint, living in a rural area. So that's kind of the premise of all this.
Where are things at with that process?
We have over 20 state agencies on a state agency committee. Then we have a stakeholder committee. We've developed a variety of subcommittees that are dealing with particular issues. So whether that be caregiving, the workforce, economic security, et cetera, those are all working literally as we speak. End of summer, midsummer, we're going to be doing community forums to go out to the public and see what they think. What are the types of things or challenges that they have? How are their communities designed? We just finished our first ever statewide needs assessment survey. We had 27,000 responses from every county in New York State. And then we'll put together a plan, which will then be a living, breathing document that can continue to be amended, adjusted as things change. And hopefully at that point, we'll be able to kind of reorganize our care system so that we can reward the community infrastructure so that you can save money on the health and long-term care infrastructure.
What else do you want, older New Yorkers and North Country residents to know about the resources available to them through the Office for the Aging and its, partners across the state?
Every single county in New York State has a county office for the aging. If there's something that you need directly or a loved one does, start with the Office for the Aging, and you can connect to them by calling 1-800-342-9871. And then I would encourage people, get out and volunteer, join civic groups, et cetera. That's the best thing you can do for yourself, is to stay socially engaged. There's so many additional benefits to whether it be volunteering or, mentoring or whatever it might be that somebody has an interest on. And then some of the free resources we have for people can go to our website. It's aging.ny.gov, and you can connect for free to our Get Set Up app. If you're caring for somebody, regardless of their age, we have a free evidence-based caregiver support application called TruAlta. And we have more as well, but you can check those things out. Those are free to anybody in New York State. That's what I would leave your listeners with.
That was Greg Olson from the State Office for the Aging, speaking with Champlain Valley reporter Kara Chapman. This week, public media stations are collaborating with his agency to address social isolation among older Americans. Olson took part in a pre-taped panel discussion that will air this Friday on Mountain Lake PBS. We have more news all the time on our website, ncpr.org. Music today by Eddie Lawrence of Moira and Jared Stephen Doyle of Potsdam. I'm David Sommerstein, North Country Public Radio.